atrial fibrillation is the most common arrhythmia that we see in clinical practice. It is a condition when the upper chambers of the heart start to beat irregularly, and this typically leads to patients having symptoms such as palpitations, chest pain, shortness of breath. But often the most devastating symptom is the development of stroke, and that's always at the forefront of our minds.
People with atrial fibrillation have 5 times higher risk for having a stroke compared with people who do not have atrial fibrillation. We know that 90% of the clots are formed in an outpouching from the left upper chamber called left atrial appendage. And with this knowledge in mind, for many years, people have tried to evaluate, can we do better for stroke prevention? Can we take that chamber out to protect them from a stroke standpoint?
When someone can't take a blood thinner, that's where we start to think about other alternatives, such as what we call left atrial appendage occlusion, to put a plug, so to speak, in that little pouch so that blood can't get in, blood can't get out, blood clots can't form, and reduce your risk of stroke. The nice thing about that is ultimately we're able to get people off of blood thinners, so your risk of bleeding is also substantially reduced.
There are 2 FDA-approved devices, one called the Watchman device and the other called the Amulet device. At Valley Hospital, we typically get a CT scan of the patient's heart prior to the procedure, which allows us to see the size, shape, morphology of the left atrial appendage, and we use that information to help determine which would be the best device for a given patient.
We implant the devices by putting an IV in your groin and threading up the equipment in the heart, installing it, and using different imaging at the time for us to make sure that we fully blocked off that area and that it's secure. And then once we're done, we release it. The nice thing about the device, it is set it and forget it, in the sense once it's in, it's well healed. It's kind of a constant feature that you have protecting you over time.
At Valley, we do not treat only the disease, we treat the patient. We take a look at all aspects for atrial fibrillation treatment, lifestyle, other risk factors that patients have, and not only one physician takes decision, is a team approach, and also the team includes the patient.
What this does is it takes a multidisciplinary approach to give a very patient-centered approach to the treatment options, how they want their ECG monitored. Do they want to take a drug or have a device therapy for stroke prevention? Do they want to take a medication or undergo a catheter ablation for treatment of atrial fibrillation? Even things like weight loss. Thankfully, we have a team that can address all of these issues, and I think that really helps patients make the best decisions.